my name is Fanta Kaba.
Okay.
Hello, my name is Rosanna Matosho.
Hello, my name is Olufadari.
Hello, my name is Doris Abuna.
Hi, my name is Fanta Kava. I am gonna do a lecture on seizure, and my group as a whole, we're doing our lecture on phenytoin, which is Dilantin, and it's a seizure medication. So I'm gonna give you a brief definition what is seizure, the cause of seizure. So let's start from the cause. The cause of seizure. Seizure normally don't have a cause, so it's idiopathic. And sometimes it is caused by fever. Once your temperature is high, mostly in children, if their temperature is high, they will have seizure. Seizure could be genetic, it could be due to hair injury, it could be due to an infection. Um, I remember one time I read in microbiology that seizure could be caused by a bacteria or a virus that enter into the brain and stays there and nobody know why it is there. So that could be another cause. Seizure could be due to pregnancy. Also, it could be genetic. It could be psychogenic, and seizure has many causes. The fact that we do not know the specific cause of seizure makes seizure complicated. Seizure is overfiring of neurons in your brain. So the neurons in your brain are overexcited. They're firing too much. They fire, they stop, they fire, they stop. Imagine a traffic light, or you be in a traffic, you're driving, you stop, you drive, you stop, especially when you're stuck in traffic for long hours on a highway. And that's what seizure is. Seizure is too much activities. It's too much activity of the neurons. They're firing over and over. All right, so I'm gonna give you the pathophysiology of seizure. Now, seizure, the pathophysiology is abnormal discharge of neuron in the brain. The neurotransmitter that normally sends electrolyte signals or charges are imbalanced, or the ion channel are abnormal, causing hyper accessibility of the neuron in the brain. The type seizure, epilepsy is a type of seizure, which is what recurring episodes of seizure. Seizure is typically defined as a sudden abnormal discharge of neuron within the brain hemisphere. Now, remember when I said earlier, generalized seizure occurs in different hemispheres. It can start in one and end up in the other. Okay? That's what's going on in your brain, depending on where the seizure is happening. So there's different type of seizure. Now, when it comes to seizure, your brain has billions of cells that are called neurons. All of those neurons are connected to create networks. Okay? Those networks are basically similar to roads and traffic lights. All right. The network, they make up and connect different part of your brain, like different towns, like different towns. Seizure happens when the neurons are malfunction and the electrical signals fired uncontrollably. So when it comes to that, I want you to think about, oh God, Jesus. All right. So now I'm gonna give you a list of different type of seizures. Seizure, we have generalized seizure. Generalized seizure is happens, it occurs in the hemisphere. It could be one side of the hemisphere or it could be both sides of the hemisphere. So seizure, generalized seizure is when the patients are having that tonic, clonic activities, they're jerking, their muscles are spasming. That's what generalized seizure. Then we have focal seizure, and then we also have absent seizure. Absent seizure is normally is in children, In some cases, majority of the time, children outgrow absent seizure. In some cases, they do not outgrow the seizure activity in their brain, so it stay in them until adult. Now, I have an older sister who is back home. She has generalized seizure, and I remember one time she had an episode. It was so bad. She dropped on the floor. Her body was shaking. She was just stiffening up, and it was hard to control it. Now, when it comes to seizure, this lack of education, especially back home, people think that the seizure patient are crazy. It's some type of witchcraft or voodoo. I don't know how to call it, but yeah. So that's what generalized seizure is, and it is very dangerous because some patients do not know when their seizure is about to occur. They will drop on suddenly, which could put them at risk for head injury. Um, with seizure, their muscles get weakened, and that cause their tongue to fall back in the back of their throat. So with that being, it put the patient at risk for aspiration. Now, as a nurse, our job is to turn the patient on their side and make sure we prevent aspiration. Our job is safety. The patient safety is very, very important when it comes to seizure.
Phenytoin, which is an anticonvulsant that treats seizure disorders. Phenytoin prevents seizures by inhibiting the positive feedback loop that results in neurological propaganda of high frequency potentials. There's a lot of drug interactions when taking phenytoin, so you need to be cautious. Corticosteroids, which are given in endocrine disorders and for inflammation, interacts with phenytoin, so you should not take those, or you should advise with your healthcare provider before you do. Digoxin, which is for the heart, is also very, very toxic when you take it with phenytoin, so that is not advised, as well as antibiotics, which do lower the mechanism of action of phenytoin. Oral contraceptives are contraindicated when taking phenytoin and should be avoided and not taken in pregnant women.
Phenytoin decreases the abnormal electric activities in the brain. The medication is used to treat and manage epilepsy. It is used to treat the tonic and clonic seizure, complex partial seizures, and status epilepticus. It is also used after brain surgery to keep the patient calm. It comes in different forms. We have the chewable ones, and that is taken 2 to 3 times daily. We have the suspension that you should shake well before you use. It is also taken 2 to 3 times in a day. The capsule, the extended release, you take it 1 to 4 times in a day, and make sure you don't crush it when using it. Precautions in taking phenytoin: you don't take it longer than what is the time duration the doctor gives you. 2, you have to be careful and read the medication guidelines before taking it. 3, you don't change from one brand to another, because phenytoin has to do with the type of brand that the doctor actually prescribed for you to take. And make sure you take it with a lot of water. The oral suspension should not be taken with kitchen spoons. It has to be with a syringe so that the actual dosage can be taken. Phenytoin includes mental confusion, nervousness, slurred speech, decreased coordination, trouble in breathing, speaking, or swallowing, unsteady trembling or problem with muscle coordination, trouble sleeping, uncontrolled eye movements, and patient might need frequent blood tests.
Patients should always check with the doctors or pharmacists before giving any other non-prescription medications alongside phenytoin, like herbal medication. Hi, I'll be talking about this education on phenytoin. As we all know, phenytoin is taken for seizure, and I would like to educate my patients to take phenytoin with food or with meal for children. But for adults, they should not take it. They should take it 2 hours if they have taken high protein food. Also, phenytoin should not be given to pregnant women. And phenytoin also has a high risk of fall, so patients should be assisted to the restroom and be cleared of any obstacles on their way. Patients taking phenytoin should not stop taking it even when they get well. They should always seek an advice from their doctors.
Nursing intervention when it comes to phenytoin, our main goal is to make sure the patient receives their medication on time, regularly, and because one of the therapeutic effects, we don't want the patient having convulsion because they don't have enough of the medication in their system. When it comes to seizure, if a patient is having a seizure episode, you want to turn them on their side to prevent aspiration. Make sure you don't restrain the patient. If the patient is on the bed, you pad the rail with pillows. Make sure you put pillows underneath the patient's head. If a patient is sitting in the position, you can lower the patient on the floor and put a pillow underneath of the patient head. Our main goal of seizure episode is safety, clear the environment, make sure there's no sharp any object that can cause injury to the patient. So you want to clear the environment. Once the patient comes through, they're going to be confused. This is the post-ictal state. Give them a chance to come back to themselves. Once they're oriented, you can help them up in a sitting position, put them in a comfortable position, but still continue to monitor the patient because seizure is unpredictable and it can the patient could have another episode of the seizure. As a nurse, I want to monitor my patient laboratory tests. I want to make sure their electrolytes are in balance. I want to check their glucose level, their sodium level, because sodium is an electrolyte. And when it comes to seizure, remember I said there's too much excitability for neurons that's going on, and your brain needs those electrolytes. When it comes to pregnancies, Phenytoin phenytoin can cross the placenta, causing birth defect to the child, where the child can bleed or lie. So you want to monitor do or a pregnancy test on the patient before you prescribe or start them on the medication. Monitor for signs and symptoms, monitor for toxicity level. If a patient is having a seizure, you want to time it. You want to know how long it lasts. You want to know what type of seizure activity they're having, their movement. So recognize those cues. You want to look for those type of cues. Um, you want to do vital signs. Check your patient blood pressure. You want to make sure they have enough oxygen. If the patient don't have enough oxygen, you give them oxygen via nasal cannula. After that, you want to document the entire process, how long, what type of seizure they had. Did they have any aura prior to the seizure? Was there any injury to the head? So you want to document all of that in your patient charts.
Hi, my name is Fanta. I'm your nurse for today. Can you please tell me your name and last name and your date of birth?
Doris Abuna,
What's your date of birth?
January 21st, 1985.
Okay. I'm here to give you your medication, your Phenytoin, and do your vital signs. Let me check your vital signs first, okay?
Okay.
So right here, Hank. Extend your arm out for me. How are you feeling today?
I have a funny feeling. I have a funny feeling.
You're having a funny feeling. Help! Help! Oh! Help! 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 Okay, okay. Go on the floor. Go on the floor. Turn around one time. Okay. Okay. It has been 5 minutes. Stop.
So now, once a patient have a seizure, you put the patient on the floor. Make sure you turn them on the side. You want to protect their hair with a pillow. Make sure the surrounding is safe. The most important part is the surrounding. Make sure there's no material that's going to be in the way. If the patient has something around their neck, a collar, you want to unbutton it. You want to take anything from around the neck. Once the seizure has stopped, time the seizure because it's important. A seizure that lasts more than 5 minutes is very dangerous. So you want to time the seizure. Once the seizure has stopped, you want to turn the patient back to their back. You want to make sure, check their respiration. You can check their pulse, check their breathing, and make sure everything is okay first. The main reason for turning the patient to their side is to prevent aspiration, choking. Most patients, when they're having seizure, their tongue can fall on the back of their throat. So that could cause aspiration. What you want to do now, after doing the seizure, we turn the patient on the side. After that, you loosen up any clothing, support the patient head. You want to make sure the patient is breathing, check pulse, make sure oxygen level is perfect. Now, if the seizure lasts more than 5 minutes or longer, you can give the patient any medication like benzodiazepine to try to control the seizure. That's the main thing. You can call 911. If you're at home, a family member can call 911 immediately to get EMT to come to you. You can check for the patient breathing and make sure they're breathing. Once you confirm that they're breathing, you can help the patient. Normally, some patients, when they come through after a seizure, post-seizure, they're confused. They don't know where they're at. They're lethargic. You can help them orient them back to their normal state. Give them a few seconds before you help them in a helping position. Once you confirm that the patient is completely back and alert and orient, you can help them in a sitting position. Help the patient in a sitting position and transfer them to a bed or somewhere that they can be a little safer.